So today we're going to discuss body mechanics and a wheelchair. A lot of our patients are going to come in a wheelchair, whether they are outpatients or inpatients from the floors. So we want to make sure that we know how to operate the wheelchair and we know how to get the patient on this wheelchair and off the wheelchair. The most important thing that you can do for yourself and your patient is assessment and prevention. So if a patient is in a wheelchair, you want to make sure the patient understands what you need them to do so they can tell you whether they can get off the wheelchair with assistance or without assistance or at all. Sometimes patients come in a wheelchair and they're coming for a procedure where they may need to stand and they're not able to do that. So assess your patient's ability to stand or assess the patient's ability to help themselves stand and get out of this wheelchair for whatever procedure you are doing. So that's the most important thing, I think, to do with a patient. The other thing you might want to do is know how to operate the wheelchair. If you haven't ever seen a wheelchair, you wouldn't know. So I'm going to go over some of those features right now. Okay. You always want to stand behind the patient's wheelchair when you're moving the patient and go forward. Don't want to go backwards with the wheelchair. Whenever you stop, you want to put your brakes on. There are 2 brakes on both sides of the wheelchair. So you want to make sure that those are on whenever you're not pushing the patient or you are going to walk away from the patient. That's very important. You don't ever want to leave a patient unattended without those locks on. Patients are often sitting with their legs on a leg rest and a foot rest. They can be lifted up out of the way so that there's room for the patient to stand safely without tripping. So that's how these work. There are also side armrests that come off if needed for the patient to move easily out of the wheelchair. And then those can go right back on. Again, remember to have your locks on and always check to be sure that those locks are working. If you are bringing a patient into your x-ray room and you are going to be doing a procedure on the x-ray table, you want to come in and park your wheelchair at a 45-degree angle to the table. Again, put your brakes on. And before the patient stands, make sure the patient is able to follow your instructions, whatever they may be, and ask if they need assistance with those steps. So the next thing you would do, obviously, is come around and move the patient's leg out of the way, move the footrest and leg rest out of the way so the patient can stand. Always assist your patient in getting out of the wheelchair if needed. If they don't need help, still stand by just in case. You're there to assist them. A patient getting on a radiographic table from a wheelchair may need some assistance as well. So you want to make sure that your table is positioned in where it's past this bucky. And if the table does not go down, you are going to use a step stool. Also make sure that the tube is not in the way of the patient, whether they're going to sit and then lay down. You don't want the patient to hit their head on this x-ray tube, so you're going to move that out of the way. When assisting your patient onto the table, make sure you stand behind them, give them proper instructions, and assist them onto the table. I have found a video on YouTube that actually goes through the process of a patient getting on and off a table, so make sure you watch that. But those are always good guidelines to go by. Communicate with your patient, ask if they can do those steps on getting on or off the table, stand by them so that you can assist them if needed, support the footstool if they're also getting on there, and always ask the patient how they're doing. If a patient is going to the wall bucky, you're also going to come in at a 45-degree angle, and again, we're going to put our brakes on. It's very important to always remember those brakes. Never leave the patient unattended in a wheelchair without those brakes on. And then come around and explain to the patient what exactly you are going to be doing. If a patient is ready to come back onto the wheelchair, do the same. Explain step by step what you're going to have them do and assist them in doing those steps, or at least stand by the patient. There are times when a patient may come in a wheelchair, very seldom, but they're not able to stand at all or even with assistance. At that point, you're going to have to ask for the assistance of another co-worker or teammate, and have the wheelchair parked parallel to the table. Put the brakes on. In this case, this patient is not going to be able to use a step stool. We are going to move our X-ray tube all the way out of the way. And then we're going to ask for assistance. Now, ideally, a patient that cannot stand to go up on a table should not come in a wheelchair, but they do here and there, so this is where you will have to do this procedure. Again, park your wheelchair parallel and close to the X-ray table. Your assistant is going to come and bring the patient's legs to the floor by moving these out of the way. You are going to stand at the head of the wheelchair. You're going to grab under the patient's arms, embrace the patient. You're going to stand with one foot forward, one back, bending your knees slightly. Your teammate is going to put their arms under the patient's knees and lower leg, again, with one foot forward and one backward. You're going to explain to the patient that on the count of 3, you're going to lift the patient. So the two of you at the same time. 1, 2, 3. You're going to lift the patient and place the patient on the table safely. Anytime you're moving your patient, always ask how they're doing. All right. This is a 2-person lift from wheelchair to table. And again, this would only happen if a patient came in a wheelchair and they're not able to stand at all. Ideally, a patient in this condition will come in a stretcher. Be very careful with patients left in a wheelchair. Explain to them that when you're moving the wheelchair, they should have their arms in, not outside, because you don't want their hands pinched in a wheelchair. Their feet and legs should be on those feet rest, and always go forward. That's safety with embodied mechanics with a wheelchair.